There is a mental health crisis within the autism community in the UK, and nobody seems to be talking about it, whether that's because people don't realise what's going on or they don't care. I did some research which I put up where it's come from. I know there are so many people that are surviving, barely getting by. The life expectancy of autistic adults is significantly lower than a non-autistic adult. There shouldn't really be any reason for that. We have no physical reason why our life expectancy would be lower. It's purely environmental factors that are causing that. There are things outside of mental health, like our awareness of danger and other societal impacts, but one of the biggest ones is suicide. If you take 3 autistic adults, statistically, 2 of them will at some point consider suicide. 1 of them will try to. 66% of autistic adults will think about it, and 35% of us will try. That's ridiculous. That's ridiculous. Those statistics are so high. I fall into that bracket. I have considered it, seriously considered it. The causes of that are rarely autism itself. They are normally coming from comorbid mental health issues like anxiety, depression, PTSD, CPTSD, that feed into our experience of life, which is feeling like we are a burden, things like emotional abuse, just generally struggling with chronic anxiety, chronic stress, burnout, the long-term effects on our body of those things. And these are all things that are treatable. Autism is not treatable, but mental health is. We shouldn't be suffering and taking our own lives because of treatable parts of the autistic experience of life. In the UK, you get counselling if you are at absolute breaking point, which basically means you have to tell them that you're going to take your own life, which I have actually told the NHS and exaggerated that point because I knew that I was on a path to get to that point and I needed the help now. That's how ridiculous the NHS mental health system is. They will wait until you are at absolutely breaking point, to the point where while I was waiting for that help, I ended up giving myself concussion and then having to go into hospital, and because I'd given myself concussion. Because they don't give you ongoing mental health support. They give you a diagnosis, they tell you you're not built for the world that you operate in, and they say good luck. 70 to 80% of autistic people have a mental health condition. So that means that while we're dealing with all these autism hurdles and autism struggles, a lot of us have anxiety, depression, and these things that we're fighting every day that make things so much harder. 50% of us have clinical anxiety. That's tough. Living with anxiety every day is tough. It's tough for anybody with anxiety. I have generalized anxiety disorder. It's not fun to live with. And when you're dealing with that on top of autism and our struggles to emotionally regulate, our struggles to communicate our need for help, then what happens is you create this whirlwind of chaos and not being able to ask for support. We are 4 times more likely to experience depression. I have had severe depression. It's what led to suicidal thoughts. And there's just not help there for us. There's not ongoing help. I've paid privately for counselling to try and keep my head above water when I knew I was struggling, and I've gone to counselling a couple of times when I've been critical. Why is there not ongoing mental health support for autistic adults when it is literally contributing to a shorter life expectancy? I don't understand. I don't understand why the NHS doesn't take seriously the autistic people that are functioning in a world that is kicking the crap out of us, is not giving us any ongoing support. When so many of us are facing mental health battles alongside living with our autistic hurdles, why is there not ongoing mental health support in place? The obvious reason is that it costs too much money, right? But the statistics are there. It will literally save lives, let alone the fact that autistic life should not just be about surviving. What about quality of life? What about not letting most of us live with depression, most of us live with anxiety,